Contact lenses are so commonly worn that it's quite an important topic. However, it's important to bear in mind that they are foreign body or foreign objects that are going onto the surface of the eye. So it's quite important to follow simple rules. The biggest rule that I always tell patients: do not sleep, swim, or shower in your contact lenses. The risk of you doing any of these things are that bacteria or different types of pathogens can get into the eye and proliferate into the deeper layer of the cornea or the outer dome of the eye. If that happens, you're at risk of corneal ulcers, which can cause significant morbidity in your ocular health and in fact can even lead to blindness. Where you put your contact lens case is quite important as well. Try to avoid using it in your bathroom just in case that the water splashes in and around the lenses or the case. If you really like to wear contact lenses, the maximum should be 4 days a week for about 10 hours, which means that the weekends should be lens-free to give your eyes enough oxygen to go into the eye and minimize the risk of any detrimental effects. Some patients have been wearing contact lenses for years and still use rigid gas permeable lenses or the hard lenses, which we know is not absolutely ideal. So if you can, the best thing to do is convert into at least 2 weekly or daily disposable contact lenses. There are different techniques to achieve this. For instance, you can look up so the lens stays inferior and take it out that way. I personally use the pinch technique, whereby the lens is grabbed in between your fingers in almost a pincer grip and just gently bring it together so it scrunches up and you can take it out. If you develop any gritty sensation, red eye, don't persist with contact lenses. The worry is that there might be a little infection and a little erosion on top of the surface of the cornea. If you put the lens in that situation, then those bacteria can go deeper and cause ulceration. So if you do feel any discomfort, ensure that you come to see us so we can assess whether the caliber of the cornea is absolutely pristine and safe to wear contact lenses. Contact lenses are a safe way to achieve excellent vision if done correctly. The key thing and the take-home message is hygiene. Ensure that you dry your hands thoroughly before touching your contact lenses and washing them very carefully to minimize the risk of any infection. Ensure that you have regular eye tests, not only to get the right prescription, but also to see whether there's any blood vessels growing on the cornea from overuse, which will have significant impact later on in your life.